I'm doing this on my webcam camera. It's just really hard to set up my little camera. And this is just easier and quicker for me. But anyways, I just wanted to give y'all a quick update about my first week of school. I still have one more day tomorrow, but we are just doing clinical assignments. Um, we have to go over care planning and stuff like that. There's a new grading policy um, this semester, so we're just kind of going over that. But the first week has been really, really good. Um, we have had a good time getting to know our new teachers. They're a lot different than our teachers last semester, so I'm really looking forward to getting to know them more. Um, we have some new students in the class, people that either unfortunately did not pass last semester or they dropped out. It's just something kind of that. There's a girl that my friends and I have been talking to who had a baby, so obviously she had to kind of finish. She didn't get to finish her second semester because she had a baby, so she's repeating again. It's really sucks. They have to repeat the whole entire semester and everything like that. But yeah, it's been really good. The first day of class was Tuesday, and we had a quick hour introduction to like the syllabus and the teacher and stuff like that, and then we went straight into lectures. So our first lecture was over the mature adult. Somebody who's reaching middle age, somebody who has turned 40, kind of in that area, the baby boomers, and then the Generation Xers who are a little bit younger. I think the baby boomers are kind of 40 to 65, and then the Generation Xers are like 39 to a little bit younger than that. I'm not exactly sure on the age, but we just talked about the changes that go on in your body, what's normal aging, what's part of a disease process, how like there's kind of a criteria that they say that baby boomers are really work related, and they may feel like, oh, I don't have to get married and have kids. I can have a career, and just kind of stuff like that. So it was pretty interesting. That is going to be for my 1509 class, which is the Nursing and Health and Illness 2, and that's going to be our hardest class. Our teachers informed us it's a 5-hour class, so it counts for a lot of credit, but they said that that's the class that they have the people have the most problems with. So yeah, that's a little bit nerve-wracking, but hopefully I'll be able to get through it. After that, we did 2 modules in one day, and after that we had a huge lecture over surgery, post-op, intra-op, or I'm sorry, pre-op, intra-op, and post-op. So that was very interesting. It's not a really difficult concept or anything like that. It's just a lot of information to absorb. So I'm definitely going to be going over that this weekend. We just talked about the different kinds of patient teaching that you need to do. Our teacher kind of gave us a scenario of you have this woman, and for example, her name is Ruby, and she's 76, and she's having a knee replacement, and she already has, diabetes, and she's slightly overweight. She takes she called it a water pill, and just kind of stuff like that, and just kind of we kind of tried to personalize the situation for her to kind of put it in a situation that we could really understand better than just kind of putting it out there without any kind of basis on it. So it was really interesting. We had 2 different teachers for each different lecture, so we kind of got to see their teaching style, and so it was really good. I'm like I said, I'm definitely gonna be going over the surgery stuff this weekend, and I really hope that during clinicals I get to see a surgery. I don't think I'd ever want to be a surgery tech or even a surgery nurse, but I just think that would be so interesting to witness. So yeah. And then on Wednesday, we had our lab class, which will normally be on Mondays, but we didn't have class on Monday because of the holiday. So right now we're doing our sterile wound care, which is not that much different from basic wound care, except for we're actually cleaning the wound and you have to have a sterile field. So I'm not nervous about the actual wound care. I'm just really nervous about breaking sterile field, because when you get into a checkoff, if you haven't had one before, or if you have had one, you know what I mean. It's just you get so nervous no matter how many times you've done it, and your teachers they're cheering you on and they want you to do good. At least for me and a lot of people I've talked to, I mean, my heart is just racing and my mind gets so fuzzy. I can't think straight. So I'm just really nervous about breaking sterile field. They have a rule: if you break sterile field and you realize it, you don't fail, but you get an automatic 10 points off, which automatically drops you from a 100 to a 90, which is a B. So that really sucks. If you break sterile field and you don't realize it, you automatically fail. And the thing that sucks is they won't tell you if you break sterile field or not. You have to ask. So if if you cross over your sterile field or you touch your face or something like that, and then you say, oh no, I broke sterile field, then you just get the 10 points off. But if you do one of those things and don't say anything, they let you finish the whole check off to see if you're going to say anything about it. And if you don't say anything, you fail and you have to do it again. And if you have to do it more than once, you can only make an 80. That's the highest grade you can make after that. So I'm just really nervous about that. I'm just really hoping I don't break sterile field because that would just suck so bad. But yeah, I practiced yesterday in lab, and then I'm going to be practicing a lot over the weekend because our first checkoff is on Monday, which is great. We didn't draw numbers yet today, or yeah, I thought we were going to draw numbers today. We didn't end up doing it, so yeah, I don't know when I go yet. We start our checkoffs at 8 a.m., which is kind of different because last semester our checkoffs never started until after lunch, either noon or 1. So yeah, that is going to be interesting. But I just know that I need to really get the sterile technique down now because we do sterile technique again in catheterization, and we do sterile technique when we do suctioning of the trachs and just whatever else. So yeah, I just really hope I can get it down. Our school puts videos up online for us to watch too for a lot of extra practice. And like I said, I practiced yesterday in lab, and I'm hoping we have open lab tomorrow, so maybe I can go after class and put some more practice in. So my husband gets home from work tomorrow. He's at class tonight until really late, but hopefully when he gets home from work tomorrow, I can have him lay on the couch and draw. We do an abdominal wound on our mannequins, but I can draw like a little red line down his stomach and pretend that he's got a wound that I need to clean. So yeah, it's basically just, not breaking sterile field, not contaminating the wound. You have to clean the wound from clean to dirty, which is basically top to bottom, and stuff like that. Counting the sutures or staples that they may have. Our patients also have a Penrose, which is a little drainage tube that comes like kind of near like if this is the stomach, like here's the incision and there's a Penrose like right over here on the side, which is like a little tube that helps the drainage go out. Our teachers kind of said that they don't really use Penroses anymore. They usually use JP drains, but on our mannequins, that's what they have. So we have to clean around that as well. So yeah, I really don't want to break sterile field. That's my main worry. But then today we just went over clinical type stuff. We got our clinical facilities. I got a different one than I got last semester, which is good. We're still doing a rehab facility, which I'm kind of about. They usually try to do acute care facilities, but yeah, there's a lot of nursing programs that have been opening up in my area, so we're really having to fight for space and everything, but there's nothing really we can do about it. I enjoyed where I was at last semester, so hopefully I know I'll get to do plenty of med passes. I'm just more worried about catheters and trachs and stuff like that because I don't really remember seeing anything like that at the rehab last time. I might have seen a few catheters, but I'm just not really sure. So I really want to be able to do that in person. So that's kind of my main thing. But yeah, tomorrow we have one more day of class and we're going over care plans. Today we went over like documentation stuff and just clinical rules and stuff in general. Like I said, picked our clinical sites and stuff like that. So yeah, that's about it. Oh, and we had our pharmacology test today, and I'm really excited because I made 100, so that's really awesome. I don't have to take it again, thank God. I was so nervous. We took a practice test on Tuesday, and I missed 3, so I was like, oh my gosh, it was making me so nervous. One of them, actually, all 3 of them I missed for stupid reasons, like just one of them I misread the question, the other one I set the question up a little wrong, and the other one was one of the med questions, and I just wasn't thinking clearly about it. It was a question about like Tylenol and could you give it to somebody with a GI bleed, and I was thinking no, because with ibuprofen and stuff like that you can't, but with Tylenol, acetaminophen, it's the liver that's compromised and not the GI tract. So, but yeah, I made 100. I'm really excited. Only a very few people did not pass, and the people that didn't pass only missed 2. So that really is, I would be really upset if that was me, just because you can miss one. So it's just that other one, which I'm sure everybody just made silly mistakes. But teacher told us they were very pleased that so many people passed the first time. So yeah, that's about it for my update so far. I will try to do another video this weekend and kind of talk more about surgery and like the mature adult, and maybe some more about wound care and stuff like that. Oh, we also had a lecture about wound care before a lab, but it was just basically reiterating the things we do in lab. So I'll try to do another video for that. It's a good review for me, and people, I